And welcoming back into the studio, Dr. Robbie Williams from Menz Medical, south of the river there. We're having a bit of a chat about Blue September. Thanks for coming back, Robbie.
Yeah, great. Gary, nice to see you. Thanks for having me.
We had a bit of an immediate reaction to our last chat. Was it last week we were in or the week before? I can't remember.
Last Monday, yeah.
Okay, then we had an immediate reaction to what we were talking about, where 1 in 8 New Zealand males could have this disease, and over 650 people, males this year, are going to die from prostate cancer. So thank you so much for those that have been listening to Compass FM and actually ran your centre, medical centre.
Yeah, we did. We got quite a bit of interest. So I was just saying somebody phoned in a few minutes after the show last week, so that was pretty quick.
We got phone calls from numerous people last Monday as well, just afterwards, just getting the number and the location. What do men expect if they make an appointment to have their prostate checked?
It depends on various factors, like, for example, have they got symptoms, and is there a family history of prostate cancer? Obviously, dependent on their age, because the older they are, the more likely they are to get prostate cancer.
Yeah.
And, like if somebody's completely well and relatively young and there's no family history and they have no symptoms, there's probably no point in getting a prostate check. But we're very happy to accommodate anyone that's got concerns about any aspect of their health, not just prostate disease, but, like men tend to be busy creatures, always working, and there's a lot of people say they don't have enough time for looking after themselves, so we do general health checks as well, not just the prostate. So from the age of 40 onwards, it's probably a good idea to get an annual medical check, which includes checking your prostate as well.
Yep. And let's face it, that if you're at the right age, but there's no family history, you're feeling healthy, all that sort of stuff, you can actually get checked through some blood tests as well?
Targeted, of course. There's no point in doing loads of blood tests and spending loads of money for nothing, so everything should be targeted. That depends on the man's family history and the nature of his job and any symptoms that he's got.
Yep.
So I think there's a good value in targeted medical checks. It's a bit like in aeroplanes. The human body is a very complicated piece of machinery, and aeroplanes get regularly checked, and they have intervals that they check things and they make sure that the parts are replaced and all that. The human body is probably a lot more complicated than an aircraft, but how many people get regular checks? It's something I think is quite important.
There is obviously a very, very strong push and recognition that breast cancer awareness is out there, and guys, you're very, very proactive in supporting that, and I would suggest that the ladies out there are very, very supportive in prostate awareness and prostate cancer and prevention, that sort of thing as well.
Absolutely. The thing with breast cancer is that they've studied what they call screening tests, and they've proven that screening tests work very well for women of a certain age. It's kind of difficult with prostate disease because there aren't any accurate enough tests to make screening, really of value. So I think for that reason, it's important if men have any concerns that you look at men on an individual basis, because you can't really apply general screening to men. I mean, you can't just sort of say, well, all men at the age of 50, for example, should suddenly have a prostate check. That would be a waste of time for a lot of men. But if it's targeted again, then I think there's good value in checking for prostate disease. And by the way, it's not just prostate cancer. We're also looking at the other big disease of the prostate, which is benign enlargement, what we call BPH, or benign prostatic hyperplasia. That's where the prostate gets bigger, and as a result of getting bigger, it squeezes on the bladder outlet. Now, this is not necessarily cancer. I mean, it could be cancer, but, there's a lot of enlargement of the prostate that occurs, which is not cancerous, but can cause a lot of problems with the bladder function. For example, getting up 4 times a night, or a slow water to extreme, or dribbling, or incontinence, all these sort of things that can affect the prostate, which are not cancer, but can be treated with medication or even surgery at the extreme.
Menz Medical is in Christchurch City. Whereabouts are you?
We're at Colombo and Beeley,
Okay.
so just at the top end of Colombo.
Okay, we'll get you a phone number in just a moment. One more question from me, because many males I know have gone through cortisone injections, that sort of thing, to make arms and legs and fingers and all that sort of stuff move again.
Joints,
Yeah, that's a very invasive procedure, and it hurts like buggery too, just between you and I, because I've actually had that. If guys can go through that sort of thing just to keep working, they can certainly go through a prostate exam as well.
Well, that's true, and people getting injections in joints, it would have to be quite bad. There's other things you can do, like go on non-steroidal anti-inflammatories, naproxen and those sort of things, and also resting the joint or getting physiotherapy. Getting steroid injections is a bit limited. You can only give one or two.
Yeah.
You can't just keep giving steroid injections.
Yeah. No, I was more thinking along the lines of the fact that that's a bit of a scary sort of a thing to actually have needles chucked into your shoulder, so you shouldn't be afraid of maybe not getting a needle stuck into
It's probably better done under ultrasound guidance, actually, because you want to get the steroid in the right spot.
Absolutely, so. Yeah, absolutely. Okay, Menz Medical, corner of Colombo and Beeley. Last time we had the phone ring pretty much straight away, not only at your clinic but here at Compass FM, to get your phone number again. So Dr. Robbie Williams, what a cool name. You must, hey, Robbie Williams calling,
Well, actually,
let me entertain you.
It's Rob Williams, but I like Robbie Williams because, people always remember it because of the singer. And sometimes you go into a shop and they say, oh, Robbie Williams.
Yeah.
And they say, have you got a good voice? That sort of thing.
But, Rob, you do have a good voice, just between you and I. What's the phone number for Menz Medical?
It's 03 981.
Yeah. Hey, hang on. I know it, because it's 981 81 81.
That's the one, yeah.
81. That's brilliant.
It's Menz Medical with a Z.
Menz Medical. Okay, just taking another note of that down as well. Guys, don't be afraid. Ladies, encourage you guys to actually do this sort of thing. They support you. You support them. It's what we do here at, it's what we do at Menz Medical and at Compass FM. Strongly recommend it. Rob Williams, thanks so much for coming into Compass. And will we do another catch-up later on at the end of this month? Hey, we'll give it a go.
Love to, Kerry. Yeah, that'd be great.
I think the more we talk about it, the least mysterious or uncomfortable it should be, okay? So we'll do that again.